Welcome back, and thank you for tuning into my channel. I'm Dr. Laurena Law, a practicing medical doctor dedicated to women's health and integrative medicine. Today, I'm excited to discuss a topic that many of my patients are curious about: the role of adaptogens in managing menopause. Let's start by recognizing a crucial truth. Menopause is a multifaceted journey. It's not just about the notorious hot flashes, which, as many of you know, can be incredibly disruptive. We're looking at a complex array of symptoms that can impact your sleep, mood, energy levels, sexual health, and overall quality of life. It's completely understandable that many women are seeking natural alternatives, especially amidst concerns surrounding hormone replacement therapy. However, I want to set realistic expectations right from the start. While there's an increasing body of scientific evidence supporting certain adaptogens, research in this area is still developing. Today, I'll share the latest findings from clinical studies, highlighting both promising results and recognizing limitations. My aim is to equip you with evidence-based insights so you can make informed choices with your healthcare provider. So what exactly are adaptogens? These are a unique class of herbs and plants believed to help our bodies adapt to stress and maintain balance. The term adaptogen was introduced by Soviet scientists in the 1940s, and these plants have been integral to traditional medicine systems like Ayurveda and traditional Chinese medicine for centuries. However, just because something has been used traditionally doesn't automatically guarantee its clinical effectiveness, which is why modern research is essential. Let's dive into the clinical evidence surrounding adaptogens, starting with the most compelling findings. Ashwagandha has the strongest evidence. Ashwagandha, scientifically known as Withania somnifera, boasts the most robust clinical evidence for alleviating menopause symptoms. A landmark 2021 randomized controlled trial by Gopal and colleagues examined 100 perimenopausal women over 8 weeks. Those taking 600 milligrams of ashwagandha root extract daily experienced statistically significant improvements in psychological symptoms like anxiety and irritability, as well as physical symptoms including hot flashes and urogenital issues such as vaginal dryness. What's particularly intriguing is that this study also monitored hormone levels. Women who took ashwagandha demonstrated significant increases in estradiol levels, alongside decreases in FSH and LH, suggesting that this herb may genuinely influence hormone balance rather than merely masking symptoms. Even more compelling is a comprehensive 2025 study by Pingali and colleagues, the longest and most thorough adaptogen research to date. This 24-week trial involved 127 postmenopausal women, assessing both ashwagandha and another herb, Shatavari, at varying doses. The results were remarkable. Participants not only reported significant symptom relief, but researchers also noted improvements in bone turnover markers, vascular function, and inflammatory markers. This suggests that adaptogens might address some underlying health changes occurring during menopause, not just the symptoms. A meta-analysis from 2023, which reviewed 5 studies on ashwagandha, showed substantial reductions in cortisol levels, perceived stress, aligning with the experiences of many women during menopause. Shatavari, or Asparagus racemosus, is traditionally recognized as the primary herb for female health in Ayurvedic medicine. Until recently, rigorous clinical evidence was sparse, but the same 2025 Pingali study provides the first solid data. Women taking 250 to 500 milligrams daily reported dose-dependent improvements in menopausal symptoms across all domains: vasomotor, psychological, physical, and sexual. Similar to ashwagandha, Shatavari also enhanced bone health markers and reduced inflammation. Rhodiola rosea is showing promise, especially when combined with other herbs. A 2020 study involving 220 women found that a blend of rhodiola and black cohosh was significantly more effective than black cohosh alone in reducing menopausal symptoms by over 70% after 12 weeks. However, data on rhodiola used independently for menopause is still limited. Let's be transparent about the areas where evidence is lacking. Maca root, despite its heavy marketing for menopause, has surprisingly limited clinical support. A 2011 systematic review revealed that only 4 small studies, all with significant methodological flaws. The researchers concluded that while maca showed some favorable effects, the evidence was too limited to draw firm conclusions. Holy basil and schisandra show preliminary evidence from single studies, but we require more research before making strong recommendations. Before we move on to practical application, it's essential to address some important limitations and safety considerations. Most adaptogen studies have been relatively short-term, typically spanning 8 to 24 weeks. We lack long-term safety data extending over years. Additionally, many studies involve small sample sizes, and there's been limited research involving diverse populations. Importantly, no studies have directly compared adaptogens to hormone replacement therapy, which remains the most effective treatment for moderate to severe menopausal symptoms. While adaptogens are generally well tolerated, natural doesn't always mean harmless. Ashwagandha may have mild sedative effects, so caution is advised if you're using other sedating medications. Rhodiola can be stimulating and should be approached carefully if you have bipolar disorder. Contraindications include avoiding ashwagandha if you have autoimmune conditions like rheumatoid arthritis or lupus, as it may stimulate immune activity. If you're taking medication for diabetes, blood pressure, or thyroid conditions, these herbs could interact with your treatments. Always consult your healthcare provider before starting any adaptogen, especially if you have underlying health conditions or are on prescription medications. If you or your healthcare provider decide that adaptogens may be beneficial for you, here's what the clinical evidence suggests. For ashwagandha, the effective dose appears to be 240 to 600 milligrams of standardized root extract daily. The 2025 study suggests that 500 milligrams daily may provide optimal comprehensive benefits. For Shatavari, the daily dose of 250 to 500 milligrams of standardized extract has shown dose-dependent effects. Take these with meals to enhance absorption to mitigate any potential stomach upset. Timing isn't critical, but some individuals may prefer taking ashwagandha in the evening due to its calming properties. Quality matters. This is crucial. The clinical studies utilize standardized extracts with specific concentrations of active compounds. Seek products that specify the percentage of active ingredients. For ashwagandha, look for withanolides. For Shatavari, saponins. Third-party testing for purity and potency is ideal. Duration and monitoring. The evidence suggests that benefits may take 4 to 8 weeks to manifest. Plan to trial adaptogen for at least 2 to 3 months before evaluating effectiveness. Keeping a symptom diary can help track changes objectively. I recommend using the Menopause Rating Scale, which is a validated 11-point questionnaire at baseline and at 3 months. Meanwhile, also note any new onset symptoms, yellowing of the eyes, or dark urine, as these may indicate side effects. When to reassess? Schedule a follow-up with your healthcare provider after 3 months to assess benefits and any side effects. If you are not observing meaningful improvement after 3 to 4 months, it might be time to explore other options. I want to clarify how adaptogens stack up against conventional hormone therapy. Hormone replacement therapy remains the most effective treatment for moderate to severe menopausal symptoms, particularly hot flashes and night sweats. The clinical evidence supporting HRT is significantly more extensive and robust than that for adaptogens. Adaptogens may be suitable for women experiencing mild to moderate symptoms, those who cannot take hormone therapy due to medical contraindications, or those preferring to explore natural approaches first. They're not necessarily a substitute for hormone therapy, but they can serve as a reasonable option for some women. In conclusion, we now have clinical evidence supporting the use of certain adaptogens, particularly ashwagandha and shatavari, for managing menopausal symptoms. Recent research is encouraging, indicating that these herbs may offer benefits beyond mere symptom relief, potentially supporting bone health, cardiovascular function, and reducing inflammation. However, it's important to remember that the research is still evolving, and adaptogens aren't a one-size-fits-all solution. The key lies in an individualized approach. What works wonders for your friend or neighbor may not be suitable for you, and what you encounter on social media may not reflect the actual clinical evidence. My recommendation is straightforward. If you're intrigued by the potential of adaptogens, engage in an honest conversation with your healthcare provider about your symptoms, medical history, and current medications. Together, you can determine whether adaptogens might be a viable option for your specific situation. Remember, managing menopause is rarely about finding a singular perfect solution. It often involves combining various approaches, be it lifestyle modifications, stress management, appropriate supplementation, or medical treatments, to help you feel your best during this transitional phase. Thank you for watching to the end. I hope this information empowers you to make informed decisions regarding your menopausal health.